and then that way I will transition to segue to Dr. Salaba. So I think it'll flow nicely into setting the stage.
You bet. Our numbers have just doubled in the last minute, so I'm going to maybe delay one more minute as people are getting their Zoom set up, perhaps many for the first time. So welcome to you as you're coming on. This is a webinar presented by C.A.R.P, and we are speaking to two esteemed members of the Ontario Association of Optometrists, and we're talking about a very important issue in Ontario. If you have a question at any time during the event, please do write it down in the chat box, and we will get to those questions in our Q&A session. And if you would like to speak on camera, in person to the panelists, please let me know in the chat box, and I will delegate you as an on-camera speaker. I had a question from Howard to all the panelists, but Howard, we had over 1,200 people register for the session, and the numbers are continuing to climb right now. We've got over just about 400 on the line right now. So maybe with that, Bill, we're going to hit the 400 mark, and I will call this this webinar to order. And good afternoon to everyone who's joining us in Ontario, and to Bill in Nova Scotia, and to all C.A.R.P members who have registered to join us for this very important discussion today. My name is Anthony Quinn. I am the Chief Community and Benefits Officer at C.A.R.P, also known as the Canadian Association of Retired Persons. And we're delighted today to bring you this webinar. I am the Technical Director for this afternoon's events, but the host is my colleague, Mr. Bill VanGorder, and Bill is the Interim Chief Policy Officer and the Chief Operating Officer at C.A.R.P. Good afternoon, Bill, and welcome.
Thank you, Anthony, and good to be here for this very important session, and very happy to see so many of our members online with us.
So am I, and welcome to everyone who's still coming in. We'll continue with the introductions. To the top left corner of my screen is Dr. Sheldon Salaba, and Dr. Sheldon is the president of the Ontario Association of Optometrists. Welcome to you, Doctor.
Thank you very much.
And in my bottom right-hand corner is Dr. Stan Wu. And Dr. Wu, you'll have to give me your title, sir, but you are the
director of the School of Optometry and Vision Science at the University of Waterloo.
The University of Waterloo, esteemed institution in Ontario. Welcome to you all. I will step back. I will pass the floor over to Bill, and I will be handling the technology side and helping with the questions as they come in. So Bill, over to you.
Well, thank you very much, Anthony. And once again, welcome to all our Ontario members and their friends who are watching today this very important topic. I'm going to speak very briefly because the meat of the session will come from our two other presenters. But C.A.R.P is, as always, very concerned that our members all across the country, and certainly our hundreds of thousands of members in Ontario, have the best available health care of all kinds at all times. We really believe, as we often repeat, that your postal code shouldn't determine the level of health care that you receive. And across the country, we have a varied landscape, a checkerboard of healthcare availability to our vulnerable older adults in all parts of the country, very different. And in Ontario right now, we have a very particular problem, and that is there is a good chance that we are going to lose our ability to get eye care in September. And this is what drew C.A.R.P's attention to this important issue. And in fact, we did a survey of our Ontario members that I'm sure many of you filled out, and almost 5,000 of you returned information to the survey. So it's a high quality survey. And what that survey told us was that Ontarians, Ontario C.A.R.P members are extremely concerned about losing their ability to get the eye care that they need. C.A.R.P did a little research into the whole area. We discovered that in 1989, the Ontario government paid about $39 to an optometrist for a single eye exam. And since then, they've only increased that amount by about 17 cents per year. Well, we did the math, and we know that it doesn't come close to covering costs that any medical professional would have in delivering the kinds of service that we expect of our optometrists. If eye care in Ontario is going to be saved, we know that the people of Ontario, you have to speak up. And that's why we're bringing you this session today, because we want you to understand the issue so you can take your own stand on it. And if you agree, as many of your peers do, that this is a situation that can't happen, that we can't lose our access to eye care at the beginning of September, then we know you'll want to reach out to your local politicians, your provincial politicians, and tell them you want change. So that's why C.A.R.P got involved. C.A.R.P wants the Ontario government and the optometrists to get together to negotiate this situation and come up with a policy that's going to assure that Ontarians continue to get the eye care that they need. Our position is when and where are we going to have negotiations to solve this problem? What is the problem? Well, that's what we're going to let our two guests explain to you today. And first of all, Dr. Wu from the University of Waterloo School of Optometry is going to fill us in on part of the situation.
Thanks so much, Bill. I appreciate the opportunity, and certainly an honor and a pleasure to address this group. As Anthony pulls up the initial slide, I want to just sort of set the stage that we have a global vision crisis. The World Health Organization last year, actually in 2019, had produced its first ever vision report. And in it, they had indicated, in fact, that there are 2.2 billion people around the world with vision loss, almost half of whom could be preventable. And this is a big challenge, right? Because obviously vision is essential. So from the time we wake up in the morning until we go to sleep at night, we rely on our vision to do all sorts of different kinds of activities. Two of the leading causes of vision loss are age-related macular degeneration and glaucoma. In the upper right-hand corner, you see a picture that kind of simulates what that might be like. So macular degeneration, unfortunately, robs us of that central detail vision. So in that picture of two boys, by looking at their faces, they're obscured. And you can imagine how difficult that makes it to read, to drive, and maintain our independence. On the flip side, there's another eye disease called glaucoma, which, although it spares that central detail vision till later on, is often referred to as the sneak thief of sight. It's like hypertension. You don't know you have it until it robs you of more of that vision. The optic nerve is damaged, and it robs us of that peripheral vision or side vision. So you can imagine the increased risk for falls and accidents and the like, and also, again, the impact on driving. And so these two sight-threatening diseases are the leading causes of blindness worldwide, and North America is no exception. According to the WHO, 195.6 million people currently have AMD, and it's projected to rise with an aging population to 243 million by 2030. Similarly for glaucoma, 76 million currently, projected to increase to 95.4 million. The importance of being able to have early detection, diagnosis, and management allows us then to perhaps change that and bend that curve in order to delay the horrible sight-threatening impacts that it can have. So we really do have, again, we would think that this is perhaps a developing country problem. But in point of fact, right here in Canada, we have the same dilemma. A recent report by Deloitte Access Economics earlier this month projected that 1.2 million people currently in Canada are estimated to be living with vision loss. The cost of vision loss to the economy, both direct and indirect, approximately $33 billion in 2019 and projected to grow to $56 billion by 2050. The other opportunities for improvement that were pointed out by the WHO that also apply to Canada are to address a fragmented eye and vision care system that includes long wait times for timely access to care and barriers to accessing health technology, both by providers and patients. So we don't come with just the problems, we also have some of the solutions. And at the University of Waterloo, we have a unique role in that we are the only Anglophone-speaking school of optometry in all of Canada. Our sister school is Francophone at the University of Montreal, but we have multiple missions that we're able to satisfy. First, we train clinically, we provide the clinical education and training for optometrists prepared to meet the eye care needs of Canadians, to be able to address that onslaught of sight-threatening disease like glaucoma, macular degeneration, and diabetic retinopathy. We also provide direct patient care services that reflect the full depth and breadth of optometry and eye care, whether it's wellness in children, being able to do those comprehensive examinations to set them up for success and educational achievement, to primary eye care, diagnosis of diseases such as, again, glaucoma and macular degeneration, so that we can have early intervention, early treatment that can to delay the onset of those progressive symptoms. Co-management of surgical situations like cataract with ophthalmology. And then finally, in the presence of that irreversible vision loss, being able to maximize functional vision through vision rehabilitation, leveraging assistive devices, technology, and training to be able to restore that independence and quality of life. We also conduct research ranging from cell to society. So understanding the fundamental mechanisms of age-related macular degeneration, how that is lost, being able to perhaps even restore and find cures for that at some stage in the future. And leveraging translational research, so using the eye as a window of the brain to be able to detect, diagnose early biomarkers for neurodegenerative disease, such as Alzheimer's and Parkinson's. And last but not least, clinical trials and research to shorten the time frame between research to application for public benefit. So what this is to say is that the School of Optometry and the profession of optometry has continued to grow by leaps and bounds since the early 70s when the school first started at the University of Waterloo, that the contemporary practice of optometry is prepared to leverage the knowledge, skills, and training and technology to provide accessible eye care throughout the country. We are numerous and we are generally well distributed throughout all aspects, all postal codes, as Bill mentioned earlier, and prepared to be able to deliver that care at the right place, at the right time, at the right care, right place, right time. So with that, I think that it is important to recognize that the limiting factor right now is not the ability or willingness of optometrists to provide that state-of-the-art care, but rather that there is need for investment in being able to help to promote that and to be able to seriously integrate optometry as part of the continuum of eye and vision care, not just in Ontario, but throughout the country. In North America, we have the most advanced practice of optometry anywhere in the world, and we train our graduates for that contemporary practice. Oklahoma, Kentucky, Louisiana, Arkansas, Alaska all have advanced procedures that enable their residents to be able to get state-of-the-art care. And soon we hope to be able to have Alberta lead the way in that sense as well. And right at home in Ontario, there is a very important challenge that we need to face. And with that, I'll conclude my comments. Thank you very much.
Thank you, Dr. Wu. Maybe we'll just go right to Dr. Sheldon for his opening statements. And you're on mute, sir.
Thank you very much. It's thanks, Stan, for that informative piece, and I want to thank everybody for taking the time to meet with us today to hear about this issue. Just wait for the first slide to come up.
Just one moment, please.
No problem.
Keeps going back to this one. There it is. Can everyone see that okay?
Oh, that's perfect. Thank you. So I guess I'm going to begin by trying to explain to you how we got here. So there's no legislative framework that commits the government to have to meet with the profession of optometry around compensation issues, like they do for other groups providing public services like the Ontario Medical Association, firefighters, police, teachers. So for over 32 years, the government has refused to formally negotiate with optometrists. And over that time frame, we have been trying to meet with various governments to try and educate them that we need a sustainable funding solution around primary eye care services. About this time last year, we launched a campaign called SaveEyeCare.ca. And that campaign was to further raise awareness of this issue with the current Ford government. And in the last 12 months, I've had over 40 meetings with MPPs and cabinet ministers to bring them up to speed on this issue. We have had patients in our offices signing petitions where I think we've had the petition read 61 times in the legislature. We sent letters to all of the MPPs back in March. So we've being very clear at trying to communicate the need for the government to start working with us around funding for primary eye care services. You can go to the next slide. So as Bill alluded to at the beginning of the presentation, in 1989, we were being paid $39.15 for an eye exam. And in 2021, we're being paid on average $44.65. So that has been a 14% increase over the last 32 years. And our costs and expenses to deliver an eye exam have increased substantially compared to that. We can move to the next slide. What we're talking about when we're talking about costs to deliver an eye exam are strictly our operating costs, which include the rent for our spaces, our staff, our utilities, equipment, taxes, and supplies. These numbers that we're going to be talking about don't talk about any compensation to the actual doctors that are providing the service. So we had done a chair time study in about, I'd say about a decade ago, and we're currently in the process of redoing that study. And that information is going to become concrete and roll out over the next month to month and a half. I know in my own practice, I've had my numbers calculated, and I practice in Hamilton, and it costs me $98 to provide the operating costs to deliver an eye exam in my practice. So I'm paying over 50% or around $50 every time I see an OHIP patient. You can move to the next slide. So with our Save Eye Care campaign, we did have an informal meeting with Minister Elliott in November of 2020. And at that time, she committed that it's not the optometrist's responsibility to be paying out of pocket for the public services that we are providing. And we met, we can move on to the next slide, please. So following that meeting, we met with bureaucrats in the Ministry of Health at the beginning of December. And since that meeting, there's been no communication with the government moving forward, even though that we've been sending emails, phone calls, trying to get them to come to the table and work with us. We've been met with silence. And the budget was delivered in March, and there was no mention of anything related to optometry services. So what are we asking for to avoid a service withdrawal on September 1st? We think that we're asking for two very reasonable commitments from the government. We're asking them to enter a formal negotiation process with us. And we understand that we are in the middle of a pandemic, but we know that they are meeting with other groups like the Ontario Medical Association. They began negotiations with them in October of 2020 on their regular scheduled basis of meeting every 4 years. And we're really looking for the same type of treatment. We want to work with the government to find a sustainable solution. And it can't be an informal meeting. We need a process where we're able to negotiate back and forth over a period of time. And we're also asking for the government to commit to providing and paying for the operating costs to deliver these services. Move to the next slide. But this conversation isn't just about dollars and cents around eye exams. I'm providing a list right here of other initiatives that we have tried to work with the government that have also been met by silence. And I'm not going to have time to go through all of them, but I'm happy to answer questions in the question and answer period should you like to. But I am going to draw your attention to number 2, because it kind of highlights what Dr. Wu is talking about, where we need to be spending our eye healthcare resources in the right place at the right time. So the government knows that people who have diabetes are not receiving enough retinal exams. I think the statistic is below 50%. And they know that this can threaten people's vision and cause blindness. So they definitely want to see more people having that included in their diabetic care. So they have created a pilot project called the Ontario Telemedicine Network, where there are 11 central locations across the province where patients can go and have an image taken of the back of their eye. And then that image is analyzed and read by an ophthalmologist remotely. There's no actual interaction between a patient and a doctor during this. And if the person doesn't have any diabetic retinopathy or bleeding at the back of the eye, it's costing the system $160 to take this image. And if there is diabetic retinopathy, we're looking at an expense of $265. Optometrists provide comprehensive exams where we are able to determine if the person has diabetic retinopathy, stage it, and determine if the person needs to be sent to an ophthalmologist for treatment or not. At the same time, looking for all other types of eye conditions that can go along hand in hand with diabetes. And we're getting paid $43.50 for this. We weren't included in the conversation about developing this model for treating diabetics, and we really need to, because we're a much more cost-effective way to get a more effective service compared to what the government is devoting resources to now on this topic. We can move to the next one. Okay, and then I'll have you advance to that one. That's great, thank you. So we've tried every reasonable solution to meet with the government, and we feel like this has left us with no choice. So if the government fails to commit to a formal negotiating process, on September 1st, optometrists will stop providing eye care to all patients covered by OHIP. We can advance to the next slide. And I think the important point on this slide is that people may think that they're still going to be able to come into our offices to receive primary eye care services if they choose to pay for it out of pocket or if they have third-party insurance. But there's provincial legislation making it illegal for optometrists to provide the OHIP portion of the eye exam if people are eligible for it. So that means there are going to be no eye exams available for children under the age of 20, seniors over the age of 65, and adults in between those age groups with vision-threatening conditions like macular degeneration, glaucoma, diabetes, and cataracts. And we can move to the next slide. What I want to touch on with this point is we know that people have already been reaching out to their members of parliament and are getting a response from the government, a standardized one, where they explain that over the past 3 years, the government has increased funding to optometry services by 15% based on utilization. And it's a deceptive way of making it sound like they're increasing funding when they're actually not. So our budget is growing, and that's because the demand for our services are growing as baby boomers are moving over the 65-year-old age category. And it means that optometrists are subsidizing even more to deliver these publicly funded services. And then we can go to the next one. So finally, I'm here to ask for your help. I want you to understand that optometrists in this province do not want to do this to their patients. We want to continue to provide care to them, and we want to avoid any interruption of service. So we're here to ask you to write your MPPs, your local media outlets, and tell them that the government needs to engage with optometry to find a sustainable funding solution. And we want you to tell them why eye care matters to you. Thank you very much.
Thank you, Dr. Sheldon. It's alarming, actually, is what my response. Bill.
Oh, yes, thank you both. I know we have a lot of questions that Anthony is going to pass on to you, but I just have a question for each of you to begin. And first of all, Dr. Wu, we've heard about the services that are being that could be withdrawn if we didn't have access to our optometrists. I know, but maybe all our viewers don't know the kind of training that optometrists get now, and the professional level, and even the change of it in the last couple of decades. Could you just comment on that, please?
Yeah, thanks very much, Bill. Optometry school is a 4-year post-baccalaureate degree. So it's a second degree professional program granting the doctorate of optometry. And with that, there's an opportunity to provide an additional 1 year of optional training and residency. So there's specialty areas in fields like vision rehabilitation, cornea contact lens, pediatrics, ocular disease. So a number of different pathways. With the past 2 decades, again, no health profession is stagnant. We continue to innovate and bring new technologies, new treatments, and new devices to the fore in order to be able to better provide care for the public. And we've been excited to be at the forefront of that at the University of Waterloo and other schools and colleges of optometry throughout North America. And with that investment, obviously, in technology in particular, our capabilities and our ability to look after folks locally in their community is enhanced. And certainly that makes it more convenient for care. And if, in fact, there is a need for additional interventions or secondary, tertiary type activities, then it's at the right place at the right time again. And so in that regard, we really feel that the contemporary practice of optometry is really at the forefront, and that it's one of those things where we graduate optometrists who could practice anywhere in North America, and sometimes they're frustrated because it's like there's one arm tied behind our backs and trying to deliver that care.
Good. Thank you to Dr. Wu. And Sheldon, question for you. We've already had comments, people saying that they want to talk with their elected politicians and others. What's the basic message that you think needs to come from the public on this issue? What do you want the politicians to hear and to act on?
I think what I was trying to highlight when I was speaking there is that patients know the type of service that we are delivering to them and how we're helping them lead independent lives and maintain their vision. But the government doesn't seem to, even though that we're telling them that, they seem to not listen to the types of things that we're saying, because they don't involve the primary eye care profession in any of the solutions around eye care. We're shut out of that. So, I think if people can describe their experience and how being able to be in a remote community and have timely access to get into their eye doctor if there is an issue, and figuring out, is it something they need to be concerned about or not, and describe the type of service. Like, we spend half an hour typically when we do an eye exam with our patients, which is much longer than a specialist spends with people. The government needs to know that these things are important to the public, and that they need to take it more seriously.
Thank you. Anthony, I know you've got a ton of questions there, so I'm going to turn it over to you.
Thank you. There's a number of questions coming in, but if we could just back to the layman's terms, the difference between the care that an optometrist and an ophthalmologist provide, and what, if nothing changes, would happen on September 1st to those over 65.
Do you want to speak to that, Stan?
Sure. So the continuum of eye care has both optometry and ophthalmology. Where ophthalmology really is very well trained and specialized is typically on surgical procedures. particularly in hospital. And there is overlap then with medical eye care. So for example, glaucoma, which is oftentimes the first line treatment is medications, optometry and ophthalmology can both independently treat glaucoma. And so there are a range of, so optometry then is really primary eye care. So oftentimes covering from wellness, diagnosis, management, treatment of disease, all the way through rehabilitation. And ophthalmology does surgical part primarily, and also is able to do medical eye care along with everything else. And the idea would be to look for a rationalization where you have the right care at the right place at the right time again. So primary care optometrist being the entry point to being able to manage most things most of the time, cataract being one example. So over time, we know that the lens gets cloudy. When it gets cloudy enough, then it's time to have a cataract surgery. And until that cataract is mature and ready to go, there really isn't a need to go see an ophthalmologist to have that additional consult. And what it does is it frees up then bottlenecks and wait times in order to have a more efficient system. And there are numbers of pathways that could be improved and enhanced with a clear coordination between optometry and ophthalmology.
And Dr. Sheldon, there's a couple of questions here about the legality of what the optometrists are proposing. Are you allowed to withdraw your services? And is deregulation what the end goal is? How is this all going to work legislatively if September 1st comes and nothing changes?
Yeah, we do understand that we are legally allowed to withdraw our services because anybody that is providing public services that are paid by the government have the right to do so. Second part of the question?
What is deregulation the goal of this campaign?
Absolutely not. What we're looking for is for the government to enter a negotiation process with us and commit to delivering the costs. As far as the outcome on how that's done, from our perspective, that is up to the government. So we just want to start working with them to try and find a sustainable solution.
And how many people does this proposed withdrawal of service going to affect as of September 1st?
So there are 2,500 optometrists in the province in I think 220 communities, and we provide over 4 million OHIP insured eye examinations on an annual basis.
4 million. The question here from Mike says, I'm an 86-year-old living with diabetes and glaucoma. I have an excellent care by my optometrist for the last 15 years. I don't know how I will go about seeking eye care. So what do we say to Mike and all the others listening to what they have to do between now and September 1st?
You know, like I was saying at the end of my slide deck, we do not want September 1st to happen. We do not want there to be any impact on patients. But because the government is not giving us any opportunities to have reasonable discussion on how to fix this, we have this period of time between now and September 1st to let the government know that they need to start taking action and sort of break this logjam. And all they have to do to avoid any type of service interruption, there doesn't have to be a solution, but they need to be in discussions with us, and they need to be committing that they're going to pay for the operating costs so the provider doesn't have to.
And Bill, coming back to C.A.R.P's point of view, we don't want to get to a situation where the province says, all right, people can over 65 can now pay out of pocket for these services. That's not the goal of this campaign either.
No, it's not. It is to have a reasonable arrangement between the optometrists and the Ontario government, like most of the other health government-supported health services have that are given. And what we don't understand is why the Ontario government is ignoring this very important service, as we've seen in the chat, extremely important to our older C.A.R.P members, and why they're not reimbursing in a way that optometrists can continue to afford to deliver the service.
Dr. Wu, interesting question from Seymour, and they're asking, because of the lack of funding for patient costs, are you seeing fewer people getting into the profession?
Well, I think part of the challenge for the profession is that obviously this is a disincentive for the long-term prospects, that it is not really integrated well or reimbursed appropriately, given the level of training, education, and investment necessary to deliver quality care. By the same token, we are unique in the sense that we're the only English-speaking school for the entire country. And so we have the privilege of recruiting the very best from all across Canada into our 90 students per class. That demand has not diminished. I think people have recognized that they can have a tremendous impact on people's lives by taking care of their vision, by being able to provide the range of services. And that as we continue to expand our ability to take care of folks, there are lots of opportunities to really be able to make an impact. In point of fact, we actually have many Canadians, actually even more than can attend the school here in Canada, going to the United States to be able to get their education and training and returning back. And so if anything, we would love to be able to expand our ability to train and educate more optometrists in Canada.
So on that note, with the interest in the field, what are other provinces doing? Dr. Sheldon, what are your colleagues in the other provincial associations? What are they having to do with their provincial funders?
You know, I think it's interesting. So Ontario is the lowest funded out of the entire country for the provincially funded eye care services that are provided here. And you really have a range across the entire country. You know, you look at Alberta and they fund public services at double the rate of what's paid in Ontario. There is no insurance for people over the age of 65 in a province like Saskatchewan. BC has a blended model where the government pays for some of it, the patients pay for some of it. And Quebec is fairly heavily insured, but they also have the ability to charge for other elements of the key components of the eye exam. And they're being reimbursed, I think, in the $70 to $80 range for their public services. So there's really, it's a smattering across the entire country.
And maybe I could just add in there, Anthony, I think the challenge is also the way that different provincial ministries view optometry. So for example, in BC, they recognize optometrists' role during the COVID crisis to try to keep people safe at home for urgent eye care. They provided access to a telehealth code and reimbursement for that. And as a result, they were able to take care of urgent needs, be able to see them in person if necessary, but most importantly, be able to keep them safe at home so they didn't have to go to emergency departments unnecessarily. In Ontario, we were not included. We were not even, after saying that we could provide this service and help to make a positive impact, denied access or even a chance to have a discussion about it. And I think that's the challenge, is that as you can see from the sort of benign neglect over 30 years, it is not because of a lack of effort to try to negotiate, to try to come to reasonable consensus. It's just that it has not been viewed that the ministry's view of optometry has not kept pace with our continued evolution and development, to the public's detriment, in my opinion.
There's so many questions coming in. It's a very interesting topic, gentlemen. One question I see coming through here regarding just the coverage of OHIP for those in Ontario. So one question was, is everyone not covered by OHIP? So myself being in my 50s, I would have to pay out of pocket. My children are covered, but my parents are covered. So there's a sort of a different tiers here in Ontario. How does that work?
So everybody gets one comprehensive eye exam up to the age of 20 on an annual basis, and seniors over the age of 65 get the same thing. Adults between the ages of 20 and 64, there are only certain medical conditions that allow them to have OHIP coverage. So healthy adults are not covered in that age group.
Yep. All right, thank you for that answer. I noticed another question coming in. So can you explain a bit more about the types of conditions that optometrists help in that continuum of care for eye care? And I watched a few of the videos on your website, how there are a number of patients whose lives were saved by having that regular eye exam and the follow-up with their optometrist. Can you get into that a bit more about the role of the optometrist in eye care, and not just what some would think, not those on this call, but some might think are more a place where you go to buy your glasses?
Sure, certainly. In 2010, we were provided therapeutic privileges in Ontario, and we were the second last jurisdiction in North America to receive those. So everywhere else, like in lots of places in the States, optometrists have been treating eye diseases with medication since the 70s, to be quite honest. So, but we did get them, and when we did get them, it was a fairly broad scope. So we treat glaucoma with eye drops. We will treat people who have eye infections. And like, let's say if somebody has shingles, we can treat them for that if it's impacting the eye. If somebody has, you know, a stye or a soft tissue infection around the eye, we can prescribe oral antibiotics for that. Treat allergy problems, dry eye. So a very broad scope and a broad scope of management. The other thing that we're very good at doing is when people are coming into our offices, we're able to stage and determine what direction the patient needs to go if they do require to see a specialist for eye care. So, you know, a patient going to their family doctor to receive that type of service, the family doctor is not going to know if the reason they're having a problem or their symptoms are related to cataract or bleeding at the back of the eye or things like that. We do when we do an eye exam. So depending on what the diagnosis is, we will send the patient to the right person at the right time.
Bill, I see you unmuted, but I note a question from Heather, and she rightly notes that the Ontario Provincial Parliament steps away for the summer on Wednesday, which I believe is in 2 days, and they're not back until after September 1st. How can we solve that problem between now and then?
Well, one of the good things about that is your MLA is going to be in the riding, going to be available to you. Actually, more available probably when the legislature was sitting. So you can, even in these days of distancing, you can still drop off a note, drop off a letter, even better, make a phone call and give them your concern. And so we think that the access to your local representatives actually will be better once the the legislature rises than it would be afterwards. Also, Anthony, I noticed some questions about the wording for when you're talking to them. C.A.R.P is providing that to all our members. Right now, you can go to carp.ca, search on iCare Ontario. You'll find a link that gives you an opportunity to find out who your provincial representative is and be able to immediately send them a message or take the wording from that message and pass it on. I'll also note, because I've seen the question, as I pointed out in the beginning, and I believe Sheldon did too, that it's illegal to charge extra for something covered by OHIP. So you won't be able to get that even if you're willing to pay. As I understand, Sheldon, is that right? It will be unavailable to you. So that's the concern, is that because it's illegal in Ontario for people who are covered by OHIP to be charged more, if you're not being covered under OHIP, that you're not going to be able to get the service at all.
Yeah, and I think the other thing that I just want to add to that, we're not going to leave anybody in the lurch either. So if we're unable to provide service to somebody who's having an emergency or something like that, we're going to help them arrange service with somebody else. So, you know, we'll make sure that they get to an ophthalmologist or, you know, send them to an emergency room, which becomes important because emergency rooms are the location where they actually have the right equipment to be able to diagnose something, but we can tell over the phone if something's serious or not. So, you know, it's important, but we're not, our goal is not to have any of our patients seriously impacted.
Bill, just back to you, and I can think for all the panelists. Maureen says she fully supports this plan, but wonders how you present this to the government when other allied health professionals such as dentistry, physiotherapy, occupational therapy don't get OHIP coverage.
Sheldon, do you want to take that one?
How do I answer that? All of those services used to be provided by OHIP, and they were delisted in 2004. And that was the period of time when the adult eye exams were between 20 and 64 were delisted as well. You know, I think the government recognizes that eye care is a really important service and something that's essential for people to be able to function, lead independent lives. It's important for children to be able to learn in school. So I think if they want to have those publicly funded services available to the Ontario public, they just need to start helping us figure out a sustainable funding solution for the costs to deliver those services. And
C.A.R.P's position would be that all health services that are absolutely necessary should be available to everyone in Ontario, and everybody should have equal access. And if there's a case to be made for other kinds of medical services being delivered that should be covered under OHIP, then we would support that also. This is a focus on eye care, but it's a part of our total concern that everybody should have equitable access to the best available health care that's available in the province.
I can't imagine if routine eye care were to be taken off the table for our demographic bill, and what the knock-on costs would be for people who are not getting the care prior to any serious debilitating.
I think from what I've seen from the questions and from my personal point of view, I wouldn't be able to see you today if I hadn't had an optometrist tell me that I had cataracts forming and do something about it right away. Otherwise, you don't see any other professional who's going to tell you that until often it's too late, or it's certainly too far on, as we saw from one of our people who commented, who said that they became legally blind by a very fast occurring situation. Yes, we all need that service, and we need it regularly.
Question in from Dave. It says he already pays his optometrist procedures that are not currently covered by OHIP, such as retinal photos, contact lens assessment, narrow angle measurements. Is there a plan to pressure the government to cover such costs under OHIP?
I mean, those types of issues are something that can be worked out once the government enters a negotiation process with us. But really, we aren't even at that stage yet to think that way. We also need to consider making sure that they're funding the core services appropriately before we start expanding out into other things. But if a healthy dialogue can begin, things can definitely be discussed in that regard.
And what have you heard from the opposition parties? The Liberals were in charge and the rates were low, and the NDP, I believe, has mentioned your plight in the House. What are you hearing from opposition leaders?
Well, I think that they think that this is a very important issue, and they have been communicating with Minister Elliott all the times that, like, I've spoken with Mike Scheer. I forget his name off the top of my head, but I have spoken with the head of the Liberal Party. I haven't spoken with Andrea Horvath, but I have spoken with Franz Schillen a few times. And, you know, they're really concerned about this, and they think that it's completely necessary for the government to come to the table and start talking to us.
And was there a vote taken by your association as to this drastic timeline to be taken?
I don't feel like it's a drastic timeline. We've been making awareness of the government for 30 years about eye care issues, and we started this back in June of 2020, where we really started to make awareness about it. So I feel like it's a reasonable runtime for them to enter very simple asks and avoid impact to patient care. So I don't feel like it's, it is a, one could say that it's a drastic step, but I think that we're giving them lots of opportunity to avoid this. But yes, there was a vote, and it was overwhelming in favor of this step.
Well, I say drastic. I apologize if I used the wrong word, but I know that I only heard about this recently through your campaign, and the members who are on our call today are only finding out about it now. So that what has been industry to government is now coming to the patient's purview now.
Understood, yeah.
Bill, back to you as I scroll through one more time. We're getting closer to the end, but there's lots of questions coming in.
There are lots of questions. One of the things that I do want to make clear, I've seen a couple of comments saying that this is a confusing issue and hard to understand. Yes, it is complicated, and there are many things about it that are difficult to understand. I see there's even a misunderstanding of what is and is not covered by OHIP in many other cases too. I would suggest again that everybody go to the C.A.R.P website, search on the I.C.A.R. link, and you'll be taken to some information that will help to lay this out for you and also give you some wording and some opportunity to have the right words when you're talking to your elected officials. I think what's clear to C.A.R.P is that we must make this a political issue, and this means that all parties need to know about it. And if your local representative is from is not from the governing party, that's fine. Let them know too. Action happens when the people who are looking for your votes in the next election that's coming up next year in this province, when they hear from you that you are concerned about an issue. You know, we could do as many as these webinars, and we could talk on the radio and do all everything we can to make the government move. But action really happens when voters tell them, I'm not going to vote for you unless you make this this right. And if we can help you, if you have questions after the webinar about specifically what you should do, let us know. Get in touch directly with me through Anthony with us. Ask your questions, and we'll make sure we get the answers to you.
Thank you, Bill. I do see the continuing questions coming in. As of September 1st, will I not be able to see my optometrist? And the answer back to you again, Dr. Stan, is... Oh, there you go.
Sorry, can you repeat? I was looking, we were scrolling through the Q&A part.
yeah. After September 1st,
yes.
As a patient, I will not be able to see my optometrist. Is that the case for everyone over 65?
I believe that is the case, Dr. Salaba.
That would, if that comes to pass, that is what would happen.
And nobody wants that to happen.
No.
No, certainly not.
And that's why we're asking for help now to be able to really bring it to the forefront so that we can get to the table, as Dr. Salaba had mentioned, and really be able to resolve this as quickly as possible.
You know, I think it's interesting for people to know that we at C.A.R.P talked to the OAO at the beginning of the year, even the end of last year, about this issue. And I think we all really thought that with the last budget, there would be attention to it, and and the government would be willing to talk about it and begin negotiating. And I think we were all very shocked by the fact that they didn't even mention it in the budget. And that's why it may seem like almost last minute urgency to our viewers, because we're talking about September 1st, but we really thought that the change could happen. We're so disappointed to see that it wasn't, and that's why we're asking you, the hundreds who are watching this webinar and the people who will watch the recording later, we're asking you to get in touch with your local elected provincial representative and tell them you want this problem fixed.
Well, I think that's a great summary on behalf of C.A.R.P. Bill. Over to Dr. Sheldon for some final words.
Yeah, you know, I'd like to thank everybody for joining and listening to us today. You know, when Bill was saying that this is a confusing topic to people, we get that and understand that. I think to summarize quickly, the takeaway, you know, the government hasn't modernized funding for primary eye care services since 1989, and they haven't modernized like as technology has developed and we're able to provide improved standards of care to our patients, because they're not addressing any funding and they're not meeting with us, we're being stonewalled. None of those things are getting included in the conversation. So that likely lends to a little bit of the confusion. But again, we don't want this to happen to patients. We do want your help. I think that it's very important to reach out to your MPPs while they're in your local communities, in their constituency offices. That is going to have an impact. They will act if they feel threatened around the issue that it could impact their re-election potential. So we're just asking for people's help to make sure that their elected representatives understand how important this is to them.
And Dr. Stan, did you have any concluding remarks?
Yes, I think I would just like to sort of emphasize Dr. Salaba's points, the fact that optometrists are here to provide care to their communities, that we're here to put patients first and really be able to look after folks, and that in order to be able to do that, it's timely for an investment to reflect the contemporary practice of optometry, the investment in technology that we have to make ourselves, and that ultimately that will help save the system and individuals greater costs down the road. And that, again, we're really grateful for the support, the attention, and certainly happy to provide additional materials or information to empower folks to make a difference. So thank you.
And to you, Bill.
Thank you. Well, I want to thank both Sheldon and Dr. Wu for taking the time to begin to explain this to us today. I think many of our eyes have been opened by the situation, and I ask people once again to go to the C.A.R.P.ca website, look at the Save Eye Care pages. There you'll find the an easy opportunity to send an email to your MPP. But remember, as one of our commenters pointed out on the chat, emails and petitions may be counted, but what really works is when you personally get in touch with the people you vote for in your community. And so please do that. Let them know that you're concerned and demand that they do something about it.
Thank you very much, Bill, and thank you very much to Dr. Sheldon and Dr. Stan, and to all the participants. We had, I think, 570 at one time. We're just under 470 now. A great return on their time this afternoon with all the information. So thank you to everyone for your time this afternoon. We'll be sharing this video on our website if you want to share it with your friends and colleagues. And keep in touch with the C.A.R.P.ca website, and we'll have updates as the summer progresses. Thank you, everyone.
Thank you.
Thanks very much.